healthy happening viewers. Welcome to the show. It is our hope that we are going to throw out to the world what's happening in health and wellness. And today's subject is erectile dysfunction. We're going to get all the lowdown on that. And I have a wonderful guest. I want to introduce him right now, get right to it. We've got the lovely Dr. Geo Espinosa in the house. He is a naturopathic doctor, a licensed acupuncturist. He is recognized as an authority in holistic urology, and that's why he's here with us. He is a clinical assistant professor in urology at New York University Langone Medical Center, and also the author of the best-selling prostate cancer book. This is an amazing book called Thrive, Don't Only Survive. Geo, Dr. Geo, thanks for being here. Welcome to the show.
Thank you so much for having me. It's anytime I get an opportunity to talk about penises or prostates, I get very excited.
We are excited to have you to talk about that. And listen, before we begin, I want to tell you this story. Seriously, because this is about, I'm going to get to our Facebook Live here so I can just pardon me 1 second here.
Yeah.
It's not there. So this is a true story. I graduated from naturopathic medical school in 2001, so 17 years ago. And my very first patient that I had as a licensed naturopathic doctor was a gentleman with erectile dysfunction.
Wow.
Absolutely unbelievable case. And I was just thrilled. He was such a great guy. He happened to be an engineer. And, you know, as my first patient, you know, just starting out, he was probably one of the loveliest people that I could have partnered with, because he was so motivated to, and he just wanted to see a naturopathic doctor. So what happened is after we were working together for quite a while, he subsequently moved to Louisiana. Now he's an engineer, right? But he wanted to keep in touch with me. And you know how engineers are with all of their spreadsheets and such. This gentleman kept in touch with me about all of his various symptoms. And the way that he kept in touch with me about his symptoms was through a spreadsheet, an Excel spreadsheet, and how he discussed and told me his progress with his erectile dysfunction, otherwise known as ED.
Right.
He called it his angle. And so,
I like that.
Tell me where his angle was, and it was perfect. I mean, it was like, it just made complete sense. But I don't mean to make, I mean, it is funny. Certainly don't mean to make light of something that I think is quite serious for men who do experience this. So as the expert in holistic urology, how many men do suffer from erectile dysfunction?
Great question. More than you think, more than people think. So all in all ages included, is about 40 to 50% of men. So in any given environment, in any social environment, in a bar, 1 out of 2 men that are there are having sexual issues, which is astronomical. Yeah. And what's happening is that younger men are also having issues. So it's not just an old man's thing. About 40% of men in their 40s have erectile dysfunction, and about 30% of men in their 30s, which is insane because they're so young and so much, or they should be, you know, have a lot of vitality and health. And about 30% of men in their 30s have erectile dysfunction. It doesn't make any sense. To me, is a huge problem, and just to excuse all the puns moving forward. There's a lot of puns, but it's a big problem.
And so why is having erectile dysfunction, I mean, such a problem? And I want to get into that, as well as if you have seen, you know, sort of maybe this, you know, earlier on previously being more of an older man's, maybe an andropause issue, and then seeing those incidents increase as our modern day progresses. So 2 questions there. Why is it such a big deal for men to have erectile dysfunction? And also, is it sort of being this, you know, early onset category?
Yeah, so it's a big deal for numerous reasons. One of them is, I don't know, some people would think shallow. Men define their manhood based on their last sexual performance.
A lot of them do, yes.
A lot of them do. So you can say, well, who cares about that? Well, it's confidence. Is your next, if you go to your next deal or business negotiation and you're feeling less manly, that plays a role in that. That plays a role with your confidence when you approach the next person that you're trying to date, or anybody that you find attractive. So that's an issue. More importantly, however, is the fact that if a man has erectile dysfunction, meaning they don't get an erection, whether it's spontaneous or an AM erection or an erection for intercourse within 3 months, there's a high probability that they have plaques in their arteries, not only their penis arteries, but their heart arteries. So, so no erection for 3 months, red flag should come up. Men should men have, unless there's several issues where they have either prostatectomy or they're on treatments for prostate cancer and things like that, different medications, numerous reasons. But men get an average of about 3 to 5 erections every night, and often they should wake up with one and feel it and see it when they wake up. Right. If that doesn't happen, there's no spontaneous, there's no erections for intercourse within 3 months, that's a huge problem.
I love it because you are sort of explaining principles of naturopathic medicine as you're speaking, because, treat the whole person, right? Absolutely. This obviously is something that affects somebody's idea of their manhood. It affects their self-confidence, how they move in the world, what they're able to achieve, how they perceive all of that. But secondly, and probably, as you said, most importantly, it's that, hey, there is something physiologically wrong. If, symptoms are our body's way of kind of talking to us, trying to get our attention. And I think this is really important for the viewers because it's a problem, and it's not just something. There's obviously a lot of jokes. There's obviously a lot of puns, as you and I have talked about. Yeah. But if this could be affecting the arteries in your penis, also your maybe it's subsequent to your heart already being affected. It's certainly something that needs to be taken up. So let's just double back on that question that I asked you. Are you seeing an increased incidence in younger men? And also, what are the causes of erectile dysfunction?
Good questions. And let me say one other thing before I answer that question.
Sure.
The penis, one of the advantages I think we have as men is that the penis is a barometer to a man's health. So it's a prudent question for when a man comes into a clinician's office to ask questions about their erections, regardless of why or what they're coming in for, right? Just because there might be part of the problem. It could be hypo, or hyperthyroid, in fact. Right. I mean, it's just so many things that affect a man's ability to have an erection, which I think we should cater, and we should look, of course, for the cause. That's the nature of our profession. Sure. Prevalence with the younger people, right? So here's what's happening. There's several things that's happening out there with the younger people. An article came on New York Times only a couple of days ago showing that teens are watching way more porn, about 10 times more porn than their fathers. And that's basically because they have more access to it.
They have access, sure.
Right. So when I was a teen, if I wanted to do so, I had to go to the porn store or the Blockbuster section of the porn XXX section, and it's a little bit of an embarrassing scenario to do that. So
yeah, you'd have to go and get a video.
You have to go get a video, and for those that don't know what Blockbuster is, God,
that's right.
Myself. So you have to go to the corner of the store in big letters, XXX. It's pretty embarrassing. Put it in a paper bag and take it back home and put it in your VCR. Again, we're dating ourselves. Dating myself.
Oh, right there with you, buddy.
So now it's easy access. You can watch whatever you want to watch whenever you want to watch it. So what's happening, right? So what's happening with these teenagers is that they're developing ideas that are unrealistic with regards to sexual intercourse. They're looking at these humongous penises that is magnified by the cameras. So they're looking at themselves and they're saying, well, I don't have that.
Right.
They're looking at the other person moaning and groaning and doing all kinds of things that it may or may not be a real scenario or happen in real life. They're looking at all sorts of positions that, there are all kinds of ways to have enjoyable intercourse. But oftentimes what you see in porn is again, unrealistic or unrealistic to your partner, what they're willing to do. There's tons of, again, even anal sex that's heterosexual. That may be something that many women are just not willing to. So they're developing these ideas
Right.
that are not real. So that's part of the problem. So porn watching is part of the problem amongst the younger men out there.
So when they so I think what you're saying also is that this could be affecting somebody's intimacy as well.
Well,
When
absolutely.
you're young, yeah, and you're having these unrealistic expectations once you get into an intimate relationship where lovemaking is involved, and then perhaps erectile dysfunction is happening based on that brain, that body mind connection.
Yep.
You can't make the connection because you haven't spent time, being in an intimate situation, an intimate relationship. You've only spent time with this outrageous fantasy life that is,
Right.
as you said, sort of blown up by the camera and has all of these acts that just happen. So that makes a great deal of sense.
And you just said something that's actually really pungent here that I think we need to repeat, which is there's a difference between having sex or just effing,
Yes.
and there's a difference between intimacy and making love.
Sure.
Right. So a lot of men get these two things confused. They look at porn, they say, I just want to, bang that or have sex with that. And they're developing these ideas where deep inside that actually may want to make love. Two different things, two different scenarios, two different ways of going about it, two different energies that are transferred. Right. So there's a lot of confusion. I just see ultimately men are just having they're just having a very difficult time in the bedroom. For lots of reasons. So younger men, another reason is that they're struggling. Their stress is very high. Adrenaline is the chemical that impedes erection more than anything else. There's nothing in the outside world. There's no chemical that you could put in your body like adrenaline with your that your body naturally just makes when you're overly stressed. That's an erection killer like adrenaline.
Let's think about this. I think it's perfect and it's so true. But if you break it down like this, and I talk to women when I'm in my practice about this as far as reproduction and why there's such an increase in infertility in our younger women, especially these days.
Right.
And I kind of say, well, when your body sort of feels like it's running from a bear all of the time, reproduction is a very optimistic goal. Okay.
Right.
It is. You are in total survival mode, not thriving, not where progesterone and estrogen are supposed to be like sort of dancing through that cycle. Everything is compensatory because why? You're running from a bear. I would say the same thing with having an erection. Pretty optimistic function and so that's the adrenaline kicking in. It's a great point.
Adrenaline and certainly cortisol, those are two things that inhibit erections. Look, it works like this. There's three reasons why men get erections. These are either there's a problem with the neural pathway, the nervous system that's connecting and talking from your brain to your penis. They have to talk to each other, and that highway, has to be clear. There can't be no jams or no problems there in that pathway. Right. The other is vascular, right? So we just need to have enough blood going in there for men to get an erection. And the third is the level of health of the muscle of the penis, the carbonosal muscles, right? There's two cylinders in the penis, and those are the muscles that get engorged with blood and where men get an erection. If there's an issue with any of these three pathways, all bets are off. Men cannot get an erection. So with the neurotransmitter aspect is you have hormones and you have neurotransmitters that are very important. Dopamine starts the whole process, whether a man thinks of sex, whether somebody touches them, whether they smell something that reminds them of their girlfriend. All these factors starts the dopamine production, and that starts everything right from the hypothalamus. Then there's a few other things that happen during that pathway. Eventually, the nerves called the carbonosal nerves of the penis get stimulated, starts producing nitric oxide, very important. Nutritional deficiencies and things like L-arginine stops the production or inhibits the production of nitric oxide, for example. And then the floodgates open in the blood vessels, the penis gets an erection only if the carbonosal muscles are healthy. If they're damaged from a fracture or they're damaged from Peyronie's, right? Curvature of the penis. If there's damage of any kind, erections become very, very difficult. So all these things play. All these three things play a major role into the successful formation of an erection.
You know, and it's great information, and I'm so happy because I want the viewers to understand that, you know, this is not this truly is, puns and jokes aside, because, you know, as I say to women who are having ovulation issues and or any problems along their entire cycle, right, when I look at a woman's cycle, I think it's a pretty great marker of health. There are so many things that I can pick up regarding causes that are deeper issues with their health when I know that somebody is either struggling with heavy periods or
right,
amenorrhea, not having periods, or them being very painful, et cetera. And I think with erectile dysfunction, you are pointed in the same way. And that is one of the most important things. There could be nutritional deficiencies, amino acid deficiencies, vascular issues, as you said, and or just that modern day too much stress, that neuroendocrine system, your nervous system, your hormones that are completely out of balance. So here's another question that I have for you.
Wait a minute, honey. So you don't see any ED patients anymore? You saw that first patient a long time ago. Is that it? I mean, I hear only,
you know,
forever.
It's you're not no. I say I have a healthy percentage of my practice that is men. I'm pretty much a family practice. I think what I'm trying to do is sort of bounce off what I'm hearing from you, because you are the expert, I think, in holistic urology, of what I actually see in that same sort of reproductive sort of organ, you know, I guess I'd call it, when I'm dealing with women. And the point is that these things could be isolated to just like, oh, sexual health, oh, sexual health, oh, sexual. No, we're everything is so connected. So
absolutely.
Men that are out there, come on in. We can get you taken care of. Right. Okay, so, but speaking of that, what should women know about men, or partners in general, know about men who have erectile dysfunction, and how are they affected?
The first thing, let's just say women for a second here, because I would say that's still the majority of that get affected if their men don't function, let's just say. The first thing they need to know right away, right now, is two things. Number one, it's not you.
Yeah.
It's not you.
Yeah.
I can't tell you the amount of couples that come in. The man comes in, I sit them separately into the consult room, and he just tells me, my wife thinks that it's her, that she's getting uglier, that she's getting older, that she's amazing, she's lovely, I'm attracted to her, is not her. And women think it, and so that starts having it's a downside cycle to their in their relationship. And that all, you know, there again, more stress makes things even more difficult. So then what happens is when he goes to the bedroom, now he has an extra layer of stress. God, I better perform. If I don't perform, she's going to think, oh,
more stress. More adrenaline.
More cortisol, more adrenaline. It's a wrap. It's a wrap. So it's not you. The other thing is that he's not cheating on you, or very likely he's not. I don't know him. But oftentimes men are really like, they think I'm their priest. And they come to me for confession and things like that. Doc, believe me, I'm not cheating on my wife. She just doesn't understand. I have a real problem, et cetera, et cetera. So those are the two things I think women need to understand. Now, older men, and by the way, I do appreciate the fact that this problem doesn't only affect men. This affects women or their partners. Sure. Because it's great quality of life. Look, if you're not having sex and you live together, you're roommates.
Yeah.
Now, all things considered, there's prostate cancer treatment and things like that you know, that do have play a role and so forth, and medications, blood pressure medications. You know, not to completely digress, but if they're on blood pressure medication, it behooves these guys to try to do things naturally, because these beta blockers, for example, interfere with erections.
So another contributing cause is medications. Something, side effects, yes.
Absolutely.
Also something to look forward to.
Antidepressants, the same thing.
Excellent. That's such great information. Antidepressants, beta blockers. And while we're on medications, I want to sneak another question in there for you.
Hold that thought. Let me say one other thing. So older men, so we said that there are three aspects. One of them is the nervous system, and it needs to be a nice and clear pathway to the carbonosal muscles, to the carbonosal nerves. These carbonosal nerves go right outside the posterior lateral side of the prostate, right? So they go right behind on the lateral side of the prostate. Why does that matter? Well, sometimes guys get prostatectomies, those nerves get cut off.
Right.
But let's say they don't get a prostatectomy, but they have BPH or an enlarged prostate.
Right.
If that prostate is enlarged enough, then it starts pushing up against these nerves, and then it causes erectile problems that are neurogenic, if you will.
Yes. Yeah.
So that's important. So if you're 52 years old, which is not old by any means, but you may have an enlarged prostate and it's pushing up against these nerves, then that will also cause problems. So I just wanted to add that one in. I'm sorry.
Perfect. No, that's wonderful. And hopefully people are understanding that this is an issue that needs a deeper assessment as to identifying and treating the cause, because you could find out so much more. While we were on the subject of medications, and your question to me about seeing people, the last guy that I actually saw that had this issue, young guy in his prime, should be just fine, but you know what he had abused for a long time? The erectile dysfunction medications.
Yeah.
So recently divorced, out gallivanting around, seeing a lot of people, using alcohol, which I'm sure you have some words to say about what that drug actually does or doesn't do to an erection, using other, I would say, illicit medications, and then to just assure that everything was okay, he sort of had the black label Viagra, if you would, or off-market Viagra or off-the-street Viagra, and that he was using that. Now, subsequently, after that sort of binge, let's say he was on, he was having a hard time reinstating his normal way of getting erection. Can you talk about that a little bit?
I sure can. God, I see these guys almost at least every other day, same story. Yeah. Pretty amazing. All right, so here's what's happening. The newly divorced, the upset guy that wants to just take it out on the world, the guy who got cheated on and says, I'm going to ram. So their mentality is, I'm just going to, F the world and just go all the way.
And F everybody in it.
And F everybody in it. That's right. So, yeah. I understand, by the way, I'm a man. I understand how we work and how we function and, But here's the deal. Number one, abuse of Pde5 inhibitors. Pde5 inhibitors are the class of drugs that includes Viagra, Cialis, and Levitra. So abuse of these drugs causes a lot of issues. Number one, it is possible that it can cause priapism. Priapism is a problem where you have an erection for more than 4 hours. So if you have an erection for more than 4 hours, please call your doctor. Call my doctor. I'm calling everybody. Some comedian said that. Yeah, call exactly. My 4 hours. I'm calling everybody. So what happens is that when you have an erection for 4 hours or more, it starts breaking down the carbonosal muscles, and that cannot be rehabilitated at all. So once you break down the muscles, it's done, right? So that's a problem. Number two, there is an element of overuse that becomes a problem. So there are guys that go to South Beach. I know them. They come back. They're like, I can't get it up. Why? They overused their organ, and it's exhausted. What happens after that? Physiologically, they can sometimes still get an erection, but now they have performance anxiety. Mm-hmm. Right?
Which makes the problem worse.
Makes the problem worse. Physiologically, yeah. Hey, do you get morning erections? Yeah, sure. But I can't do it with my wife or my girlfriend. Do you get spontaneous every now and then? But I can't do it. They have performance anxiety. So as soon as they, it's very common for a guy to fail sexually, and that just stays in their subconscious mind and conscious mind. They go into the next one. They're like, oh, I hope I can perform. Last time I couldn't. And they're trying the Viagra. They're trying all kinds of things to be able to perform. So performance anxiety occurs even though physiologically they can perform.
All right. This is such great information. And I think that one of the biggest points that I've gotten out of talking to you is that this is a big issue. There are a lot of jokes and a lot of puns around it, if you and I have said, but that it's, potentially a medical issue. And if you lead it, to getting it checked out and identifying and treating the cause, it could be a life-saving decision that you make. So not a light subject at all. Definitely affects people emotionally, their quality of life, probably financially if their confidence is down. So my biggest and best final question for you, and this is why you're really here, okay?
Oh.
What can people do about it? And naturally, here, tell folks on Healthy Happenings what's happening when it comes to treatment.
Got it. Wow. So here's where we're going with this. Let's break that down like in bullet points, right? At least that's how my mind works.
Yeah. And sure, everybody's case is different, right? Because as you said,
that's why I'm hesitating.
Factors. Yeah. I know it's not an easy question for that, because you got to understand people's history. We should say that, if you are on medications, that's a contributing factor. We need to suss out all of the modern day contributing factors to why anybody presents to our offices. But give me a try.
So what I would say is this. The first thing I would say is that be cautious with using Pde5 inhibitors, Viagra, Cialis, Levitra. This is not candy. Just because
it's not a fix, it's a Band-Aid.
It's a Band-Aid, and it can be not a great Band-Aid. Yeah. I got to be honest.
Can do harm.
The male mentality, of course, is whatever it takes. I just need to get busy, whatever it takes. That's I get that. And in some cases, I've said, look, we're trying to rebuild your penile health. That's going to take us a couple of weeks. You have a hot date tonight, no problem. Take Viagra, Cialis, take this dosage, a smaller dosage, because the poison is always in the dose, right? So the higher the dosage, the more likelihood of there being some sort of side effect.
Yeah.
Small dose, along with natural prescriptions that I prescribe. We'll get to that in a second. Take them together, and then boom, you'll be fine. Okay, that's number one. Number two, Pde5 inhibitors. A major issue with them is delayed ejaculation. No one talks about this. Okay. No one talks about this. Why? Because these drugs numb the penile nerves that go right to the head of the penis. That's the head of the penis is the area where there's more sensitivity, and that's where the pleasure is for men when they have intercourse. Well, these drugs actually numb. They put these nerves to sleep. Right. So then men sometimes get delayed ejaculation. Now, the guy that has premature ejaculation, he's saying, oh, where do I sign up? That's exactly what I want. I want to last longer. Be careful what you ask for. Be careful what you ask for. Men with delayed ejaculation are more frustrated than any other type of men I know. Why? They go and go and go. The partner is tired, and they still have an erection that they cannot resolve. They have to go and masturbate in order to ejaculate.
Got it.
Okay, so that's that. Next is you got to address the underlying cause. So I would suggest see either a naturopathic doctor or a functional medicine doctor. See them, and they will evaluate you in the inside of your body, your hormones. You have to look at testosterone. You have to look at free testosterone. You have to look at prolactin, because too much prolactin inhibits the production of testosterone, and it might have a negative effect directly on erections. You have to look at cortisol levels. You have to do a metabolic syndrome evaluation. You have to look at a lot of things. So that's how you address the cause. So that's that. The third thing is you want to stay lean and mean. So let's talk about exercise for a second, if you don't mind, because that's very important. Some people say, I exercise a lot. I just ran a triathlon this past weekend.
No.
Well, that may be a problem, because the training for and I'm just saying triathlon, but it could be any hyper endurance activity.
Sure.
Cortisol levels are through the roof, because that's a stressor. That's a stressor. And typically guys that do ultra marathon, cortisols are high, testosterone is actually low. And free testosterone. Now, I ran marathons. I love it. The high you get is cool. Sure. Just understand what the downside of that is. And you might have more fat than you think. When I do a body composition test, a lot of these marathon runners have a lot of fat in their system, so they're becoming still more estrogenic because they have too much aromatase activity. What I'm suggesting is more interval type of exercise and weight resistant exercise. And I have clear instructions of what they need to do. But bottom line is more weight resistance, more interval, and not more than 30 minutes. And that's one method of not only if the problem is testosterone, increasing testosterone, but also getting back erectile function. The supplements, ingredients, and nutritional and nutraceuticals that I like to use, and excuse my bias, I am a partner with Natural Partners. They have a formula that works pretty well, but the ingredients, I'll just say the ingredients because it's science based, and science and comes from quite really a lot of yeah. So here's how it goes. A lot of people use arginine. And arginine is fine because we said earlier that that's a precursor to the production of nitric oxide. That's important to widen the arteries to get more blood flow into the organ.
And just for everybody's edification, arginine is an amino acid, so building block of our protein molecules.
Correct. Problem. There's a lot of arginase throughout our system. Arginase is an enzyme. It breaks down arginine. So we have it in our livers. We have it even in our digestive system. So while arginine may work, you need about 5 grams, and you need to split that up 3-4 times a day.
All right.
Compliance is an issue, right? So how do I get more arginine into my system without using arginine? The answer is L-citrulline. So L-citrulline actually is a precursor to arginine, and studies been very clear. You get more arginine in your system from L-citrulline than from arginine itself. So L-citrulline is a much better nutraceutical to use than arginine, in my opinion, and my research.
Right. The other, it is such a great, Geo, I want to stop you for a bit.
Yeah.
It's such a great piece of information because I completely agree with you. And that is why, as the doctor and the expert in holistic urology, we have you here because those are the important pieces. How to treat erectile dysfunction naturally, certainly understanding that it is a very big problem, not just in one space, but in a whole person's life. A relationship issue, financial issues could be leading to or be caused by deeper health issues. And so this piece is really, really important.
Thank you. Absolutely. Thank you very much. Look, I excuse my bias. Look, I'm the only holistic functional medicine naturopathic doctor at NYU in urology. I work only with medical doctors, and we work synergistically. We work well together, and they get it. If you want more deeper stuff, more cause-related things, go see Dr. Geo. If you want the quick fix, come see me. We have the drugs, we have the injections, we have the pumps, we have the implants. Depends what you want. What you want. I'm looking, our philosophy. I live by our principles as naturopathic doctor. All right, I'll get off my soapbox for a second now. Other natural things that you would find in a good supplement. So epimedium is a Chinese herb. out in the streets, we call it
horny goatweed.
The horny goatweed, baby. Those goats. Those horny goats.
That's what it's called, yeah.
It is what it's called. Funny name, but here's the deal. Horny goatweed has a chemical in it called icarin, ICARRIN. That chemical, lo and behold, is a Pde5 inhibitor.
Wow, just like it is, just like the drugs from, as you said, Viagra, Cialis, etc.
And Levitra. Same effect. Now, here's the deal. So then am I at risk of getting some of the side effects if I drink or take epimedium? Not quite, because number one, it's one ingredient out of 100 or so. Right. So the amounts is not, I've kind of through trial and error know how much you need to take to get some sort of a response. But no, it's virtually impossible because when you use a herb, the herb pushes and pulls, right? There's synergy. That's why it has all its other components. It's not just icarin. If you were to concentrate icarin and only icarin, then that would work like Viagra, Levitra, and Cialis. But that's not what we have here. So epimedium actually works, and it works very well. The other is rhodiola. So rhodiola is an adaptogen, and those that are in the botanical medicine, herbal medicine field, we know that adaptogens helps our bodies adapt to stress and it helps with our adrenal glands. And a lot of adaptogens historically have been used for erectile dysfunction. Rhodiola in Siberia is one of them. So from a scientific perspective, there is a direct benefit to erectile dysfunction, but this is what studies do show. It shows that people that are overworked, let's say residents or just overworked, they work 15 hours a day, they get a normal level of extra energy when they take rhodiola. In other words, they're less exhausted from taking rhodiola. Well, what's one of the problems with ED? People work a lot and they're exhausted.
Yeah,
they're exhausted. So they go and they think they want to, but they can't. And, life gets hard. Another pun. And they can't. And so rhodiola. Now, I am biased towards rhodiola for two reasons. Number one, it gives me more data, and I like to look at the science before I formulate or anything like that. So I'm biased. But I got to say, other adaptogens work very well. Ashwagandha, another adaptogen, works extremely well. Siberian ginseng works very well. So adaptogens, primarily rhodiola, in my opinion, works very well.
No, I was just going to say, for time purposes here, because these are great. This is great as far as there's natural synergistic ingredients to actually treat this problem. All of course, while we're looking for the cause. And I'm sure diet has a big thing to do with it as well. You mentioned exercise, because you mentioned also potential cardiovascular disease being a cause. So I'm sure diet can contribute to more of a healthy erection and less ED along the way, correct?
Correct. So and it goes right along with what my next point is, which is you have to take care of the endothelium cells.
Yeah.
Right. So the arteries, you don't want them to harden. You don't want them to get hard or atherosclerosis of the heart, and you don't want atherosclerosis of your penile arteries. All bets are off there. If they get too hard, they don't dilate, no blood going into your penis. So there are things like pomegranate extract and even resveratrol you find in red wine. That doesn't mean you drink 5 bottles of red wine.
I got my resveratrol dose. What are you talking about?
Exactly. That doesn't quite mean that, because then all bets are off. Alcohol is a depressant. Too much alcohol is a depressant. And while a little bit of alcohol helps you get your little swag on and helps you, cool it off and take the stress off, too much alcohol is a depressant, and then you're not going to be able to function as a man. So resveratrol, and that's why I use it in supplements, and pomegranate or pomegranate extract, very, very important. Dietarily, look, keep just treat metabolic syndrome, even if they don't have metabolic syndrome. So low carb diet and those kind of things. Lots of fruits and vegetables, plant-based. Get lean and mean, and you'll be lean and mean in the bedroom.
Dr. Espinosa, thank you so much. This has been so wonderful. So just to wrap it up here on Healthy Happenings, erectile dysfunction, not a joke, big issue. Identify and treat the cause. Plenty of wonderful natural things you can do. Seeing a practitioner, getting fully assessed, because our bodies, when they're symptomatic, no matter what it is, they're trying to get our attention. So if in doubt, go get it checked out, because there's plenty of things that we have in the natural realm that can take care of it.
Holly, may I say one last thing very quickly? So I have the great pleasure. So, Oxford Press Publishing, they have a series of books through Andrew Weil, so integrative cardiology, integrative etc. So I had the great pleasure of being one of the editors for integrative sexual health. Quite frankly, it's going to be a game changer in this space of integrative medicine for sexual medicine. It's coming out in April. It's lay people can read it, as well as, like all those kinds of books. Doctors can read it because it's highly referenced and pretty scientific. So integrative sexual health, I just want to plug that in really quickly. It's coming out in April, and I think it's going to be a really, really good resource for people that are struggling, and doctors who are treating men with any sexual dysfunction, whether it's female or male. So I just wanted to let everyone know.
Absolutely. Great. All right. Thank you once again for being here on Healthy Happenings, folks. Thank you so much for watching. And sexual health is part of our larger health, so keep that in mind. And until next time.